All righty. Welcome everyone to the Children's Commission 2024 Summit. This year's series is titled Stories of Our Lives Strategic Sharing Summit, and we are happy and thankful that you took some time this evening to be with us. Before I get into what we're going to talk about today, I first have a few folks to thank. First, I want to thank Casey Family Programs, our funding partner, for making this happen. I also want to thank our youth representatives, one of them who is with us today, who helped plan this year's theme and content. And I want to thank our many community partners, too many to name, that help us connect with speakers, panelists, and do a lot of outreach work for our attendees. Last thank you goes to Peyton, who's on screen here, our commission interns, and all other court staff who do so much work in the background to make this happen. Before we get started, next I'll move into some introductions. I'm Blaine Cook. I'm the coordinator for the Children's Commission, and I'll pass it to our executive director, Mark Fairchild, to introduce himself quickly before, for those who may not know.
Hi, everybody. Mark Fairchild, Executive Director of the Commission on Improving the Status of Children. Happy to be here with you all tonight, and also proud intersectional professional. Anthony will describe that if you haven't heard that term before in a little bit, but thank you all for joining us.
Thanks, Mark. And for those who don't know, many of you might do or might already know, but the Children's Commission, a little background there, exists to help state agencies work across all three branches, help them work together to improve outcomes for Indiana's youth and families. The Children's Commission has an ongoing commitment to systemic collaboration, which is right up Anthony's alley, and that's why we picked him for this as well. But we also always are working to constantly uplift and engage youth and family voice. Each year we host a summit. This year's theme and structure, like I mentioned, decided by our youth representatives, is strategic sharing. This series includes 3 parts: tonight's keynote, a training on November 6th, and a Young Advocates panel discussion on November 21st. On February 17th and 18th of 2025, we plan to continue this discussion at an in-person event in downtown Indianapolis. So more details on that coming in the future. But again, thank you for being here. Before I pass it off to Allie, some technical stuff first. We are recording this, just so you know, so that those who can't make it still get a chance to watch. And we can, of course, distribute that out later, too, for those who want to go back and watch again. Please talk in the chat. Please use the chat. We will be monitoring it. Please use the question and answer box as well. And we're happy to interrupt, discuss. We want this to be interactive. And I will monitor that, and I will do that as needed. So that's all I've got. Allie, I'll pass it to you.
Thank you, Blaine. Hello, everyone. My name is Allie Leonard, and I'm one of 2 foster youth representatives on the Commission for Improving the Status of Children in Indiana. I am very excited to introduce our keynote speaker, Anthony Barrows, who is a social justice advocate and trailblazer in strategic sharing. I had the pleasure of first hearing and learning from Anthony during the national convening of the Best Youth Initiative teams in DC this past July. And Anthony is a founder of the Center for Behavioral Design and Social Justice, where he organizes a network of intersectional professionals with lived experience to build community and pursue systems change rooted in research, evidence, and human-centered approaches. So his dedication to this work is inspired by his belief that it's possible to build better systems that actually work for the people they're meant to serve. Thank you for being here with us tonight, Anthony. I will pass it off to you.
Amazing. Thank you for that kind introduction. And super glad to be here. Thank all of you that have shown up and all of you who are going to be listening in the future. And I'm going to share my screen and walk folks through a quick presentation. If you've heard me talk before, this is going to be a little bit more personal at the beginning than I normally share. And so what I'm going to do with you all tonight is walk you through a little bit of my personal and professional journey. So you get a sense of who I am, where I came from, and some of the professional choices that I've made before walking into some of the work that I've done. And all of this really hinges around a commitment that I have to elevate lived experience in the halls of power. So if we're designing programs, designing policies, delivering services, it's my lifelong commitment that we are listening to and empowering people who have lived experiences of those things to be making choices that shape what those things look like. But as I said, I'm going to start with a little bit of a personal side of this so that you all get a better flavor for, who I am as a human being before I tell you about all the work that I've done. So let's start there with my journey. So I'm a Bostonian, born and raised, lived there for 30 years, although I now live in New York City. And my journey started there even before I was born, when I was in utero, as a beneficiary of all the public services that you can imagine. So from the time that I was gestating, I was a beneficiary of the WIC program. I grew up in public housing in the projects in Boston, first in the Maverick Square development, and then in Old Harbor. And you may know the Old Harbor projects. That's where Whitey Bulger, famous Boston gangster, held court for decades. And I certainly lived there when he still ran the place. Was a beneficiary of the SNAP program, which was then and still now is colloquially known as food stamps. And I used to spend those things when they were beige pieces of paper that I was really embarrassed to have to walk down to the corner store with, and so on and so forth. I name the program, nonprofit or public, and I was probably a part of it from the inside throughout my youth. And importantly for this audience, this included the foster care system. So I went into foster care when I was a teenager. And simultaneously into the juvenile justice system. And I know lots of folks are involved in both, even though the world may only identify us as being involved with one. And what I'll say is that I will never forget the night that I went into foster care. So my mother and I had not gotten along for quite a long time, and I had two younger siblings at that moment who weren't even in elementary school yet. And because of the arguments that my mother and I were having, she was nervous. She was scared of me, frankly. And one night in the summer, called the police. And this was after I had fallen asleep. She left the house, and I woke up to banging on my front door and looked out the little peephole in my apartment. There was one guy standing out there saying, "Hi, I'm a police officer. I'd like to talk to you." And so I unchained the door, unbolted the deadlock, and opened it. And in charged half a dozen police officers who tackled me and dragged me out in the middle of the night in front of all of my half asleep neighbors who'd opened their doors and windows to see what all the ruckus was and all the flashing lights, and threw me in the back of a paddy wagon, and off to jail I went. And my life, which was difficult up to that point, we struggled with poverty, we struggled with lots of things that people do in this country, was never the same after that, and got even harder. So up until this point, I think that the best that I could see for myself in terms of outcomes was rooted in the stuff that I saw around me in those projects. Which would have been something like maybe joining the armed forces like my brother had before me, maybe being a mechanic like he was, and making a decent hourly salary. These were the options that seemed right to me because I knew I didn't want to go be a gangster like Whitey Bulger, and I knew I never wanted to get locked up, even though at this moment that's exactly what was happening to me. But those were the options that seemed likely and plausible to me. Maybe join the armed forces, maybe get a blue collar job. And if you had told me then at 14 that one day I would be somebody standing in front of audiences with 3 degrees, doing things like applied behavioral science and policy advocacy, I would have probably laughed at you because it seemed really implausible. But what happened to me after I went into the foster care system, because it was very challenging, I should say that the flip side of that coin is that it also opened up a lot of possibilities to me. But the beginning of that, the going was very rough. And so bounced around a lot of group homes in Boston, got to know lots of neighborhoods that I'd never been in because that's where they were located. Rode the subway to places that I had never been part of before. And I think that my lowest point in those first several months was when I was living in a group home on my 15th birthday. And this was the summer before I started my sophomore year of high school. And like most group homes, they did the right thing. They tried to throw me a birthday party, but they couldn't invite anybody in. This was before we had cell phones, so I couldn't even find my friends. Even if I could have, they wouldn't have been invited. And I will always remember the feeling of what it's like to sit in a room full of strangers, celebrating what should have been a really happy day of my life, and realizing that none of them were there for me. They were all there for the free cake. This was a low point in my life, but things started picking up soon thereafter. So as a Bostonian, one of the things that I had access to was a really good school system, and that's still true today, that Boston is one of the cities with the best school districts in the country, and one of the best schools in the country, which I had been really lucky to get into. This is the Boston Latin School. And as we were approaching the return to school, I had court dates that I had to go to along with my social worker. And you can hear more of this story in detail if you were to Google me and find a talk that I gave at the Aspen Institute. But in essence, I had a judge who was really willing to listen to my perspective as the system was making choices about what was going to happen in my life. And after a room full of adults was discussing where I should go, were there relatives? Would it be better to get me out of the city? At some point, the judge that was overseeing those proceedings paused that conversation and asked me where I wanted to go. And so at one of the lowest points in my life, I really made a transition to one of the highest points in my life, which was as a teenager, being asked by someone in power what I wanted. And what I told that judge was that I didn't care where they put me, as long as they kept me in Boston, because I wanted to stay at my high school, at Boston Latin School. And when he heard that I was at Latin, he said, knowing how good of a school it was, make sure that he stays here. And I did, in fact, manage to stay in Boston, went back to school sophomore year, reconnected with my friends, managed to graduate that school a number of years later. And I don't know how my life would have turned out if one adult, in a moment where he had no reason to listen to me, hadn't stopped all the other adults from talking and hadn't taken seriously a request from me rooted in my expertise about my life, because I knew that school and the friends and teachers and supports and stability that it offered was the one thing that was keeping me going, the one thing that was keeping my hopes up in this really dark moment of my life. And that really set a path for me to make sure that if I ever got into positions of power, I would make sure to listen to those people whose lives were being affected. But after returning to my high school, I managed to get placed into a foster home where I stayed for 3 years, stayed there until I went off to college, which was an extraordinary piece of luck. Most people that live in foster care bounce around a lot more than I did. But because of that stability, along with the stability of being back at my school, I also got lots of other opportunities. And so, this is the other characterizing definition of my time in foster care, other than learning how important it is for adults to listen to young people, was recognizing just how lucky I had it, especially as compared to many of my peers and my colleagues. Because I managed to stay in my school, got one foster care placement after a handful of group homes. And because of that stability, started doing a little bit better in school. Still wasn't great as a student, still got in lots of trouble, got suspended a lot, got arrested still, but managed to stabilize enough that the people in the department who were in the adolescent services area looked at me and said, hey, maybe there's something with this kid, and started getting invited to the youth advisory board, then got offered a position manning the teen peer line, where I was giving advice to other young people in the foster care system. Went on to doing trainings with people in the department to help prospective foster parents understand what it was like to parent a teenager. And did lots of other kind of public speaking and advocacy work rooted in this recognition from another set of adults that it was critical for us to listen to the perspectives of young people as they were thinking about how to make the system better. And was able to parlay all of those opportunities into further paid opportunities while I was in college. Managed to stick around after I graduated from high school and sign myself back into the system, and was able to do a lot of advocacy, because in that moment after you turned 18, and this is, you know, for me back in the 90s, so it was a different world than it is now. It was a lot harder. There were very few states. Massachusetts was one of the few where the standard was that you were able to stick around after you turned 18 as long as you were pursuing an education, and was able to do a bunch of advocacy because of all those opportunities, because of that luck, because adults were listening to continue making the system better. And we were able to achieve a bunch of different things through that advocacy, including changes to the over 18 policy to make it even easier for people to stick around, including tuition waivers to state schools, as well as a foster child grant program, which helped pay for school if you wanted to go to a private school. So, you know, great if you wanted to go to UMass like I did to get that tuition waiver. But what if you got into Harvard? What if you got into MIT? What if you got into Amherst College? This was a way for the state to say, like any good parent would, we want to support your education and give you the resources to do it. And all of those opportunities were only because of this immense luck that I had to be born where I was and to have people see the promise in me, but also the extraordinary opportunities that were given because adults were willing to listen. But this period of my life was really characterized by both that instability as well as that luck. But what it left me feeling was really this question of, how in the world do I get out of this situation? And so that's what really characterized my youth and my young adulthood. But as I said, I got lots of opportunities to stay involved with the department and do advocacy. And that led me to the next part of my journey when I was able to graduate from college. And what I chose to do next was to enter back into that world, but this time as an adult and as a professional, as a person providing the services that I had really benefited from. So from the time that I graduated college all the way through 2008, I was in the world of direct service. So spent a bunch of time working with young people that were in the foster care system. And again, was super lucky that right out of college, the folks that had been taking care of me, mentoring me, guiding me in DSS and then later DCF, took a flyer on a kid who had a philosophy degree and an art degree and said, you know what, you're smart enough, we know you, we trust you, come work in our independent living department. And so spent a couple years in Boston doing that work, helping young people who are only a few years younger than me figure out how to make those same choices and take those same actions that led to my success. So how do you create a resume, go apply for a job? How do you look for your first apartment and cobble together some kind of down payment? How do you look for a co-signer and get some adult to trust that you won't ruin the apartment and lose their money or not pay the rent and leave them on the hook? And that was good work. You know, I felt like I was able to really return the favor that I'd been given. And eventually moved out of Massachusetts, moved out to California, and made a change in the next role that I had, which was doing, instead of that independent living work, which is really important, we all need to have life skills. We need to know how to run a budget and go grocery shopping and get a license and all those things. But I made a change after a few years in California to do work on what was then a new movement, which was called adolescent permanency. And so joined an adoption agency to become a recruiter, to make sure that teenagers in the foster care system didn't age out of the system without permanent connections to people who cared about them because they cared about them, not because they were being paid. And this was a kind of radical idea for me because I had really been steeped in the idea that what we needed to do as alumni of the foster care system was to get our stuff together, you know, to make sure that we had the skills, we had the connections we needed to go out into the world and succeed. And I had paid much less attention, partially because the system wasn't set up to ask me to pay that attention to the relationships in my life and to making sure that I was keeping a hold of the family, chosen and otherwise, that had really supported me. And so I was super persuaded when I heard about this job that this was really the thing that I needed to dedicate the next part of my career to, was making sure that every young person in foster care if they can, has a legal relationship with someone. And that could be reunification, that could be adoption, that could be guardianship. And failing that they have a committed relationship with somebody that'll be there for them no matter what. And so spent several years doing that work, doing family finding, digging up records of, long lost second cousins and uncles and grandparents, and helping people reunite with members of their family that they had become disconnected with just because that's an artifact of how the system worked. Finding new connections for people, where we could get adolescents adopted, but also making sure that we were having explicit conversations with people that already cared about teenagers, your soccer coach, your geography teacher, your next door neighbor, who may not even know that these young people were in need of that kind of permanent connection. And spent several years doing that work, which was some of the most fulfilling work that I've ever done. And it really changed my perspective on what systems need to do for young people, because yes, we need good services, we need good programs, we need all the knowledge in the world, we need good education, we need to make sure that we've got a path to independence and taking care of ourselves. But all of that is kind of meaningless if we don't have people, if we don't have family, if we don't have those permanent connections. And so was really privileged to do that work, ended up supervising that work and running a program, which was one of the earliest ones in the city and county of San Francisco to do this adolescent adoption work in partnership with a public agency. And so this part of my career was really characterized by a different question than my youth and young adulthood, where I was really thinking, how do I get out of here? This part of my career was instead defined by a question that I think a lot of you are asking, which is, how do I give back? Whatever your experience may have been, I'm sure many of you feel grateful for some things and maybe a little resentful of others. But I know most of us are really interested in making sure that the folks coming up behind us through these same systems have it easier than we do. And this was really the question that I was asking myself throughout this part of my career. Now, at some point, I at this time had met my now wife, then girlfriend, and she is from Puerto Rico and was sick of being on the West Coast because it's too far from home. So we made the mutual decision that we were going to move back east, and take the next step on both of our journeys, personally and professionally. And I wound up back in Boston. And in this circumstance, I was able to make another pivot in terms of what I was going to do with my life, in terms of what I was going to do with my career. And so, whereas the early part of my career was really about direct service, working with families, supervising those direct service staff to make sure that young people's lives were being improved, I was able to do something a little bit farther out, a little bit farther up. And I thought with a better leverage point to impact more people. And so this started my next phase of my career, which was in system improvement. So when I got back to Boston in late 2008, took a job in early 2009 with the New England Association of Child Welfare Commissioners and Directors. And I was super amped about this work because it gave me a chance to really spread the impact that I was making across an entire region. So for those of you who don't know New England, this is a 6-state region in the upper Northeast. So Maine, Vermont, New Hampshire, Massachusetts, Connecticut, and Rhode Island. And the association was a membership, and still is a membership organization, of the people that lead the child welfare agencies across those 6 states. And they were engaged in a project that they hired me to run to do some system improvement work around safety and risk assessment. And so I was able to go out into big cities and small towns across the 6 states and work with these interdisciplinary teams, which included office leadership, frontline staff, importantly, also young people and parents, as well as folks from supporting agencies like mental health agencies, to reimagine what it meant to assess whether a family was safe enough to maintain custody of their children, contact with those children, to plan for how they would get them back if they'd been removed, et cetera. And that work was exciting. I was able to do some innovative work that was really being built from the ground up. So to call back on that lesson that I learned from that judge, really listening to the people that were experiencing this stuff and using the insights that they had to inspire change, but importantly also to test whether that change worked, and then to talk across these offices and across state lines about what was working so that we could spread the successful innovations as far as we possibly could. And if that's the only work that I did at the association, I would still be extraordinarily proud of it, because we instituted some changes that are still in effect, including changes to have it be part of policy and practice that people called the family before they showed up to knock on their door, which is, in my mind, like basic respect, but wasn't always practice, wasn't always the case, among many other things. But alongside that innovation work, I was able to do some other work, which was really exciting, which was an outgrowth of work that I had done in my own youth. But again, because I was working at this regional level, gave me a path to scale that I hadn't experienced before. And this was doing some youth organizing. So when I was a teenager, through my early 20s, I was involved in all kinds of advocacy, sitting on that state youth advisory board, being asked to sit on commissions and panels and advocacy groups, advisory boards for the governor and the executive office of this and that. And that work was extraordinary, because as a young man, a person in my teens and 20s, I was able to speak directly to decision makers and tell them what needed to change. And what the association gave me was an opportunity to do that same thing for people across the 6 state regions, and to do it collectively. So we built something called the New England Youth Coalition, which was an aggregated advisory board, which plucked people from the youth advisory boards from each of the 6 states and gave them direct access to the commissioners of each of those states to do the things that they needed to do, say the things that they needed to say around how these systems needed to serve them better as young people in foster care. And we were able to get some great successes there, including having each of the 6 states sign on to a Siblings Bill of Rights, where each of the systems promised to do a variety of things to keep siblings in touch with each other, including preferring to have them live in the same place, but ensuring lines of communication if they couldn't. And if that weren't enough, I was also able to set up something here on the screen called the Mass Network of Foster Care Alumni, with support from the Commissioner of Massachusetts Department of Children and Families, which was designed as an alumni organization for people who were adults who had been touched by the foster care system that wanted to continue to build community around those identities and experiences. And we launched that right before I left the organization, and it's still going strong, 10 plus years later. But what all of that work taught me, what all of those experiences left in the back of my mind, was a kind of hunger to make an even bigger difference, to have an even deeper impact, to have an even broader reach with the work that I was doing to try to improve systems. And so had to take a hard look at myself in the mirror and realize that, I had an undergraduate degree, again, for those of you who didn't catch it the first time, a double major in philosophy and art. And then had gotten a master's degree when I was in California, an MFA in printmaking, and realized that with those degrees, with all of those certifications, no one was going to make me the assistant commissioner of anything. So I needed, if I wanted to keep increasing my reach and the influence that I was going to have on people, needed to get a different kind of degree that kind of stamped my passport for a visa into the world of management. So went back and got a policy degree. And while I was at school doing those studies, studying for that degree, I kind of got converted to a different way of thinking about where my career could go, still aligned with the system improvement work, but in a way that I thought would get me upstream of a lot of the problems that people involved in the child welfare system were experiencing. And so if you know the stats, this won't be unfamiliar to you, but there's, depending on what state you're in and when you do the time slicing, about a 70-30 or 80-20 split of neglect versus abuse in terms of who's coming into foster care systems. And if you unpack that vast majority of cases, that 70 or 80% of cases that are coming in for neglect, very frequently, not all the time, but very frequently, those cases are really just poverty in disguise. And so there's been a big conversation happening over the last 10 years in the world of child welfare about how we can stop that conflation. How do we stop systematically confusing poverty with neglect? Not having enough of a key resource with not wanting to do the right thing by your kids and your family. And so while I was in policy school, got really excited about doing anti-poverty work and got really excited about a tool that we could use to do that work, which is applied behavioral science. And so when I left policy school in 2013, immediately joined the organization listed here, Ideas 42, which is an applied research firm. And I'll give you some examples a little bit later on in this talk of work that I did there. But the idea for me was if we can get upstream of child welfare, that means doing work to end poverty. And one of the most effective ways we can do that work is by continuing to do the system improvement work, but maybe with a different set of tools. So, okay, another inflection point in my life here. So as you'll remember, I started off thinking, how do I get out? And then I got through that period and asked myself, how do I give back? But throughout this part of my career, what I was really asking is, how do I make things better? What are some ways that we can improve the circumstances that people are in, improve the systems that they rely on? And that work was super important, and I continue to be proud of it all. But after about 9 years working at Ideas 42, where we did lots of really important work, we ran randomized control trials, so I can tell you with a high degree of certainty that what we did worked and improved people's lives. I was left still wondering what else was out there. And so for the past 2.5 years have been doing something new, which is what we call systems change. So if that work that I was doing before was about system improvement, meaning how do we make the status quo easier to bear? How do we make it easier to navigate, easier to understand? How do we slightly improve some of the eligibility criteria or make more generous the kind of stuff that's being given out? The way that I would call systems change out as something different is to say, our aim is really about trying to answer this question. Not how do we make existing things better, but how do we build something entirely different that is superior to the things that we have. And so towards the end of our talk today, I'm going to give you some perspectives about what that looks like. But what I'll say here is that our aim with the center is to unleash ourselves from the stuff that exists today in order to give ourselves permission to dream about what could be tomorrow or 10 years from now or 100 years from now. Our aim is to lean into what's possible, not just what's plausible, and to do that rooted in something that I've brought up repeatedly today, which is the irreplaceable value of lived expertise alongside all of the really important insights that we can get from research. And an outgrowth of the work with the center is the network of intersectional professionals, which I will tell you about in more detail as we go. Okay, so that is now we're in the present. I brought you up to speed about where my life is. And this is the work that I've landed on for this part of my career, is acknowledging, valuing, loving all of the work that comes along with systems improvement, but really committing myself as much as possible to systems change and trying to radically transform the systems that I've relied on into something that people coming up behind me will be able to really succeed in faster and more easily than I did. So to wrap up this section, before I move into the next piece, which is going to give you some concrete examples of some stuff that I've touched on more abstractly, what I want you to do is to just reflect on this image, because if you forget everything else, I want you to remember the punchline of this slide. So I want you to imagine that you're out somewhere in your neighborhood where you live, wherever the nearest body of water is. For me, I live a couple blocks from the East River here in Manhattan, but you could imagine this is Boston Harbor, the Mississippi River, the Great Salt Lake, Lake Erie, wherever it is people are, wherever it is that you are. Imagine the body of water nearest to you. And imagine that you see this enormous pile of dead fish floating in it. What I want you to remember is to ask yourself a different kind of question than society usually promotes for us. And what I want you to ask is, what's wrong with the water? Not how do I change the way those fish are behaving? Because this is often the thing that we're asked to do metaphorically. When we think about improving systems like the welfare system, like the child welfare system, like the mental health system, like the education system, we over-fixate on how to get individuals in that system to make different or better choices. And we very rarely take a step back and say, well, what's wrong with the system that people are making these kind of choices? What's wrong with the water that we've got so many dead fish? And what can we do to fix that before we try to fix the behavior and choices and actions of the individuals within it? Okay, so I'm actually going to pause here, see if there's any questions that came up in the chat before I move on to the next section. And if not, I can move right along.
We've got a comment from Alyssa saying that nuanced perspectives of systems is extremely helpful. Collaboration is everything when trying to work within the systems that we seek to improve. And I also have a message from a question directly to me while someone's watching live asking about, you mentioned a key interaction with a judge when you were young.
Mm-hmm.
Whether we are in a position like that judge, whether we're a caseworker, whether we're a teacher, or whether we're just a peer, we all have power in our interactions. This person asks, what can we do with those interactions, and how do we make sure that they stand out? Because that, like you mentioned, changed the trajectory of your life when they asked what you wanted to do. What can we do, whatever our role may be, to make sure we make those interactions count?
100%. It's a fantastic question. I'm glad you asked it. I think that it's going to vary, of course, depending on your position, depending on the amount of power and influence that you've got. But perhaps the most important thing that you can do is to continue listening, and to make promises that you can keep around what you can do to act on what you hear. So in my experience, one of the quickest ways to lose trust, especially with people who've been through the system, because for really good reasons, we find it hard sometimes to trust people, especially if they're associated with those systems. For those of us who've had those experiences, one of the easiest ways to lose our trust is to ask us our opinions, to ask us our preferences, to imply that you're going to do something about those things and then to never act, or to somehow do the opposite. So I think my advice to you would be, keep doing whatever you're doing in terms of establishing a relationship and trust where young people are brave enough, comfortable enough that they're sharing with you what their priorities are, what their wants and needs are. And then do whatever you can that's within your power to make sure that somebody who has say over what those needs and preferences are is going to act on them. So it may be the case that, if you're just a frontline social worker, you can't control what the area program manager or the commissioner is doing, but you can be clear with the young person that you're working with just how much influence you've gotten over what, and then deliver on whatever it is that you're making a promise around, which may in that case be simply relaying this information and being in their corner as they fight for what they're asking for. But yeah, respecting their voice and doing whatever you can that you've got in your power to move their preferences forward. And frankly, sometimes also giving young people feedback if they are making bad choices or their preferences are maybe not aligned with their well-being. I know I got a lot of that, even though I didn't want to hear it when I was a teenager. But some of those words stick with me. I remember very clearly, for example, and this is like a non-controversial thing, but some of you may recognize yourself in it. When I was in college, I did some internships, and I did internships in a variety of places, but one of my favorites was interning with Outward Bound. So I got to spend a couple summers fixing boats in Boston Harbor, like stripping down the stain, repainting, restaining, stitching sails, and this was, I was in heaven, I was like out on the ocean basically. But I had mentors in the department who were kind of giving me the side eye and saying, Anthony, don't you have a little more ambition than just to be out there fixing boats? Like, shouldn't you go do the CCAI internship, or don't you want to get an internship somewhere on Beacon Hill with some lawmakers? And I was like, definitely not. I'm cool fixing boats. Now, looking back on that when I was in my mid-20s or mid-30s, I was like, what was wrong with me, But they definitely were giving me that feedback, listening to my preferences and, letting me make my own choices, but definitely not letting it slide, giving me the kind of feedback and guidance that anyone who cares about a young person should be giving them. So that was a very long-winded answer. Sorry.
No, that was great. Thank you. And then this last one comes from a young person. They said, as an intersectional professional, you, Anthony, are constantly advocating for others with similar stories to your own, but also working within a system, like you said, that may be working against those people as well in some way. How do you take care of yourself in your role now, or especially when you were young in your career?
Yeah, easier now, for sure, because I've got a little more latitude in terms of how I spend my time. I've got a little bit more money. I'm in, a partnership. I've got a wife and a family, so that, there is a built-in safety net, emotionally, financially, and otherwise. If things go awry, I've got, lots of room to process that, to deal with it. And so thing number one is making sure that your social well-being is taken care of, which is really rooted in having a good team of people, starting with friends, starting with family, including, importantly, mentors, including, near peers that are a little bit older than you, as well as folks that are decades older than you, to give you guidance, to give you support, to give you feedback. Making sure you've got that social circumstance as strong and diverse as it can be is the most important advice that I can give you. And when I was younger, it was a lot harder because I had a smaller network. I didn't then, and still don't, have a really robust connection with any of my biological family. In my 30s, I reconnected with two of my older sisters, and we talk regularly. I see them on a regular but not frequent basis. But I didn't even have that, ability to text them when I was in my 20s and my early 30s. So when I was a younger adult, what was really important to me was that I practiced good self-care. So when I was in the best mindset and the best physical well-being in those early parts of my career, I was eating right, exercising, drinking a lot of water, drinking less than I might have at other points in my life, and making sure that I was building what would become that more robust social network. So I think my general advice is build yourself a village. Make sure that village is diverse in age and lots of other ways. And as you're working toward building that village, make sure that you're taking care of those basic needs that we all have, including our minds, our hearts, our spirits, as well as our bodies. But, it's hard being a young adult. And, when you find peers that you vibe with, mentors that can give you the right advice, near peers who can be really good examples, hold on to those people for dear life. They're the most valuable thing you've got.
Cool. Thanks, Anthony.
Awesome. Okay, we'll have more time for questions as we go. But this next section, what I really wanted to do, because I've been trying to make the case throughout this whole time that lived experience matters. And I learned that as a teenager, practiced it throughout my career, continue to practice it now. But I want to make sure that you understand why it matters in a really concrete way. So as I said, in my previous role, worked at a place called Ideas 42. So I'm going to give you 2 examples of where lived experience made a huge difference in projects that we ran that then had a huge impact on people's lives out in the real world. So the first example is from a project that we did with San Francisco State University. So there's a big public school in the Bay Area, and they had a problem where they were experiencing people dropping out of school. And this was about 1 in 5 students, so 18%. Were dropping out sometime between the first day of classes freshman year and the first day of classes sophomore year. And when we looked deeper at the quantitative data that they offered to us, what we found was that only 7 of those 18 percentage points represented academic problems. So 7 of these 18 percentage points were people like not completing remediation, not attending class, getting failing grades, whatever it might be, which leaves this big chunk of folks, 1 in 10 students, a little more than 1 in 10 students, leaving for no discernible reason in their record, nothing to do with how they were performing in school. So if you were to ask people out in the world why students were dropping out, you would get some plausible answers from some of the usual suspects, which would be people like education researchers or administrators at school, or maybe even just like people randomly that you ask on the street. Why are people dropping out of school? And they would tell you things like this. Maybe they just weren't ready. They went to a bad high school. They don't know how to study. And so certainly that's going to be true for some number of these students, but it wasn't in any way driving those 11 percentage points of students that were doing just fine academically. So for those students, what else might it be? Maybe San Francisco is an expensive place. Maybe they didn't file FAFSA, or they filed late and missed out on some aid. Maybe they couldn't find housing and the expensive real estate market kind of drove them away. But when we looked a little closer at the data, we couldn't find any strong correlations between applying late for FAFSA or failing to get financial aid and dropping out, or applying for the dorms and not getting approved. So we couldn't really say this was what was driving it. So, okay, I don't know how many of you have tangled with school, but when we actually talked to the students themselves, rather than just listening to the usual suspects, the academic traditional experts, we heard a different story about why people were leaving. So when we talked to students and when we talked to the staff that were directly supporting them, we got a different version of why people were dropping out. And this included stuff that I'm sure those of you who are listening have felt at one point or another in your lives. People worried about whether they belonged there, especially students that were coming from far away or that were first generation to college. They felt disconnected. Many of them just felt like they didn't have a niche. They couldn't find like who their social group was, or some of them also reported feeling like I'm the only one struggling if they got a bad test on a midterm, or a difficult feedback on an essay or something like that. So these are very different reasons for people leaving the school. And the reason that this matters is because we would have done different things if we hadn't talked to the students, listening to them, listening directly to these young people about what their lives were like and what the problems were in their environment led to a different kind of thing than if we had listened to the usual suspects. So if all we had done was listen to the researchers, some of the literature, some of the administrators, what we would have done is probably this stuff. We would have sent people reminders about financial aid, maybe would have like rewritten some of the housing forms to make them easier to navigate, maybe given them some direct supports on how to get through various pieces of administrative requirements. And I'm here to tell you, none of that stuff is bad. I'm sure it would have helped a lot of students, frankly. And I would never argue that we shouldn't do this. It's just that it wasn't going to solve the problem that students themselves were telling us they were experiencing. So because we listened to the students, we made a different choice and came up with a different kind of intervention, which was rooted in solving some of these problems and involved helping people develop a better sense of belongingness, as well as some habits that would help them feel like they belonged quicker. So we worked with the cinema department on campus to develop a video of upperclassmen and recently graduated students to reinforce this message that it's not you, it's us. There's nothing wrong with you. This is a natural part of the environment. If you're struggling, this is normal. It's typical. We all go through it. And here's a bunch of stuff that you can do to get through it more quickly. Join a club, get some tutoring, whatever it might be. And after delivering that video to half of the student population, the other half got whatever the normal video was. We then asked students to think about what pieces of it resonated with them, capture that information on a survey, and then spit it back to them once a month in text messages and emails. And this included some of the stuff that the usual experts told us that we should, which included stuff around housing, financial aid, and so forth. And so this worked really well. I'm not sure if any of you on the line are education researchers, but this number here, this 10% increase in persistence year over year, is mind-blowing. It's a really large number. So for those students that got this, again, half of the incoming freshman class, among them, the people who are most at risk of dropping out, so first generation of college students from low-income backgrounds, and or from far away from the Bay Area, these were the ones who experienced this really enormous increase in persistence year over year. And we saw non-statistically significant, but still promising increases in grade point average and credit completion. And so, this leaves me to ask the question, would we have seen anything like these numbers if we hadn't asked students what was going wrong and then built an intervention around what we heard? Okay, one more example that I want to walk you through. Again, this is from my work at Ideas 42. We were partnered with the New York City Housing Authority, aka NYCHA, which is the public housing authority here in the city. And they are the largest public housing authority in North America. They're the largest landlord here in New York City, housing 1 in 15 of my neighbors. It's bigger if you were to consider it a city than many other cities across the country. So it's an enormous place, and they were having this problem with trash disposal, which is something you might imagine in an agency of that size. And so if you've never been to New York City, you might not know it, but we have a weird way of disposing of our trash, which is to just dump it on the sidewalk in bags. And so this is no different in NYCHA, but it was causing lots of problems, including increased smelliness, disorder, disarray, but also rats. So NYCHA wanted to solve this problem, and we asked them what they thought was causing it. The people that we talked to really misunderstood what was driving the choice of NYCHA residents to put their trash in areas that were explicitly marked, please don't put your trash here. So when we asked those folks, they told us stuff like, well, this is the projects. People just don't care about the environment. People don't care about keeping it clean. Or they're just flouting the system. They see us put up these signs and they just decide that's where we're going to put it. Maybe we need to ratchet up the fines or the enforcement of these rules because people are just scofflaws. They don't understand. They don't care. And as somebody who grew up in the projects, I was mildly horrified when I heard this kind of stuff because I knew it wasn't true. And we were able to verify that by actually talking to people that lived in NYCHA. And what we uncovered was at the root of it, what the real issue was, which is that in NYCHA developments, this is how most of them have in often high-rise buildings, 10, 20 stories high. These are the chutes that they've got in the trash rooms, which are only going to fit a bag about this size, something like you'd get from the convenience store. And so people can dispose of their trash to some degree in using these vessels. If you've got food scraps or dirty diapers, you might put them in there and drop them right down the chute, and that's going to work out fine. And for big things, there are always these large containers tucked away in some part of the developments where you can put your couches, your mattresses, other big pieces of furniture. But it should be noted that these are often 3 to 5 blocks away from people's homes. So you've got to literally walk several minutes to get to them. But what you don't see here yet is this, which is the typical sized trash container for most of us, a 13 to 33 gallon trash bag. This is how most of us keep our trash in our households. And here's the thing. Policy in NYCHA says that you should be putting it here. But I don't know about you, in the middle of the winter, maybe with this dripping something kind of stinky, there's no way you're going to get me to walk 2, 3, 4 blocks to this dumpster to get rid of this trash bag, especially if I'm elderly, especially if I have limited mobility or if I'm trying to drag my toddler along with me. And so this leaves a real problem. You can't put it here because of any number of reasons. So where do you put it? And that's what leads us to these giant piles of trash outside the developments in ways that neither the residents nor the NYCHA folks are excited about. And this is despite the fact that people in NYCHA actually take out their trash at a higher frequency than most of the rest of the country because they recognize the difficulty associated with this policy. So most people in the US take out their trash 1 to 2 times, 2 to 3 times a week. In NYCHA, people are really throwing out smaller amounts of trash down those chutes to solve this problem. But it is really difficult for those people who have those larger trash bags that accumulate about where to put them. So again, same kind of pattern with the San Francisco State thing. If all we had done was listen to NYCHA administrators, these were the diagnoses that they gave us. People don't care about their environment. People don't understand the problem with rats. And we just need better rules, higher fines, more enforcement. But when we talked to people that actually lived in NYCHA, they told us about this mismatch. We have trash bags that don't fit in the chutes. We have drop-off sites, but they're really inaccessible. And we too want a clean environment. So if we had listened to the administrators, these are the kind of interventions we might have come up with. We might have done some persuasion or education around how people need to make different choices individually about their trash. We might have even increased fines to make it more expensive if you got caught putting your trash in the wrong place. But because we listened carefully to people who understood this stuff firsthand and lived in this environment, we did something completely different, which was to change the environment that they were in and improve the infrastructure that they were dealing with. So seems really simple in retrospect, but this is what we did. We put these tilt trucks outside to hold, 7 or so of those big trash bags, as well as regular trash cans throughout the site so people could throw away their soda or their dog poop as they were walking from one building to another, and let them know about it through some posters, and saw this marked decrease both in improperly disposed of household trash, so a reduction of 25%, which is pretty marked, as well as less litter and less improperly disposed of dog waste. So again, begging the question of what might we have seen, what might we have done, how well would it have worked if we had just listened to the usual suspects, the usual experts, rather than listening to the people who are experiencing these things themselves. So the big takeaway here, the big punchline from these two examples of work that I've done is that without lived expertise, we are really at risk of solving the wrong problems. I'm sure you can imagine all the ways that that's gone wrong in your life already, as well as ways that it could lead to us misusing our time, our energy, and our resources. So what I'd love to do here, if we might, is to have those of you who can maybe give some examples. And I'd love to see this populate live on the screen if you've got examples of this, when you might have seen in your own life, in your own work, in your own community, where lived experience has given us answers that typical approaches to research couldn't. So I'm going to give us a couple minutes. If you can just go to menti.com on your phone or on your laptop and enter in that code 63376367. Would love to hear a couple examples if you can come up with them. And we'll just pause there and see if we get some responses.
Peyton's put the link to that in the chat. So once you get there, just enter that code and we should all be able to see the responses together.
Not everybody all at once. Absolutely. Suicide prevention and other forms of mental health are really great examples of this, especially because not everyone has lived through that, lived through the difficulty of struggling with something like suicidal ideation. I will put something like substance abuse disorder and recovery in here as well. So one of the most important examples that we've got of lived experience really revolutionizing an entire system is the move that public health made toward harm reduction models. And harm reduction as an approach came directly from people who had struggled with substance use themselves. And so, substance users were the ones that really inspired and helped spread that practice. Kinship caregiver needs, absolutely. So one thing that I didn't touch on when I was sharing my journey earlier is that I often joke that I won the foster care triple crown because not only was I a youth in care who then went on to doing direct service social work and system improvement work and supervision, but I'm also an adoptive parent and I'm a kinship adoptive parent. I adopted my nephew. And I will tell you that even talking to typical foster parents, you don't get the same information. You don't necessarily get what we kinship providers are going through, and really important to lift up that lived experience. Same insights, I'm sure, with students not attending school in high school and elementary school, as well as in college. Really important to listen directly to them. Definitely important to do things other than just giving surveys. The disability community is super important too. And if you think about the ways that universal design has changed our built environment, it's a great example of how if you listen to people with disabilities, so people with mobility limitations, let's say, folks that are in wheelchairs, and create environments that have things like ramps and curb cuts in them, not only do you improve those people's lives, which is a good and fair and just thing to do, but you make it easier for a lot of other people out there as well, including people that are pushing carriages and strollers, people that might have a hard time just getting their feet up on a high curb. So excellent examples here. Love the example of talking about how being in poverty has nothing necessarily to do with your motivation. Some of the hardest working people I've known in my lives were folks that were working 2 and 3 jobs because none of them paid enough to create a family sustaining wage. And absolutely listening to people who are trying to navigate their own well-being by accessing programs like food stamps. So awesome. Thank you for participating. I think you all get the picture. You're already persuaded. How are we doing on time, by the way, Blaine?
We've got half an hour left.
Okay, cool. So I'm going to roll through the next two sections kind of quickly just to make sure that we've got time to answer some of your Q&A. But the next thing that I want to talk about is what do we do about this? So because I hope you're persuaded that lived experience matters, I want to talk about what it looks like to actually use lived experience. So one of the things that I've been doing in my job recently at the Center for Behavioral Design and Social Justice is pushing forward some research to answer this question: does the research literature actually support the claims that we're making, that lived experience matters, and if you use it, you'll get better outcomes? So one of my funders challenged us to try to answer this question, and I'm going to give you the most abbreviated version of this that I can, because I don't know how many of you are actually interested in unpacking the methodology here. So I'm just going to tell you what our findings were, which is that at a high level, outcomes that policymakers care about show promising but not strong positive results when you bring in people with lived experience to design and deliver programs. So this is stuff like medically, can we get people to lose weight, to take their meds, to make safer choices? We see an increase, but it's a small one when programs are co-designed with people with lived experience, which may sound like bad news, but the good news is that there's stuff that leads up to that, which show incredible results. So this includes stuff like, do people feel like they've been treated with respect? Has their knowledge about the issue increased? Do they feel better? Do they have a changed attitude, a changed positive attitude toward the program, toward the issue, toward the community? Do they feel like they've been included and like they've got a sense of belonging? Have they increased social capital and connections? And this is both for people that are getting services as well as for the people that are delivering it. So when you draw lived experience into the design and delivery of programs, according to the literature that we saw, almost always you get better outcomes in these areas. So for us, setting this aside, and there's some like methodological limitations I won't bore you with that make us think that this number is lower than it actually is based on the inability to observe stuff. We should be really excited about this. And from both a practical and ethical perspective, we think this makes a really good case for lived experience being built into the design and delivery program everywhere that it possibly could moving forward. If you're ever interested in making this argument, I'll give you the QR code if you wanted to download the paper and share it with people. But more important than that are some of the best practices that we also glean from the same literature, from the same meta-analyses that we were reading, which includes our general advice that on Sherry Arnstein's ladder of engagement, organizations that want to do good co-design should be aiming at these top 3 rungs of partnership, delegated power, and control when they're doing work with communities, which means engaging in negotiations, conversations, and trade-offs minimally when it comes to generating new programs, improving existing programs, et cetera, all the way up through, and this is very rare, but it's something to aspire toward, actually giving over full control, including the resources that come with it, to communities that are affected by an issue. So that's our general advice. And our more specific advice, and here's the QR code if you wanted to follow it and read the paper yourself, is to follow these 5 best practices, which include mindset shift, where people that are running a program, people that are in power, need to believe that lived experience is its own form of valuable expertise. So in no way would I ever say that it doesn't matter to have economists giving you advice, or mathematicians, or sociologists, or psychologists. All of those people, all of those disciplines have really valuable knowledge, but so do people with lived experience. And so that mindset shift of taking our lived experience just as seriously as you take the advice of a policy analyst is thing number 1 that we think needs to happen, followed by the intentional investment of resources. So if you want to engage people with lived experience, make sure that you're doing things like paying them for their time. And if we're going to get that kind of outcome, that means people at the top, people in leadership, paving the way and displaying that they're bought into this stuff. Followed by, importantly, making sure that when we draw people with lived experience into this kind of work, they represent the broad array of a community, which means the stuff that might immediately leap to mind, making sure that people from different races and ethnicities in a community are represented, the different languages are spoken are represented, the different age groups that are affected are represented as well. In addition to that, we also need to think about what I call the affective dimension of it. So making sure that we're not just talking to the superstars that are usually the people at the table, but also people that are irritated and angry with the organization or the system, and the big chunk of people that are somewhere in between. And if we can do all of that, then we need to make sure that we're building explicit infrastructure for power sharing to make sure that all of the rest of these changes are durable and don't go away when there's a change in leadership or when some stream of funding runs out. So just to give you an example of what this looks like out in the real world, as part of writing the paper, we did some interviews, did some case studies, and this one is really important. And I hope will be resonant for those of you on the call. And this is Pure Health Exchange. They're a public health organization that works with young people whose whole model, their entire reason for being, the entire way that they were created from day one, from the moment that they came into existence, was premised on this idea that young people themselves have the best idea about what they need to hear about in regards to their own physical well-being. And that near peers, so like college students talking to high schoolers, are one of the most effective ways to share that information. So they were demonstrating from day one what it looks like to have organizational leadership committed to this idea of lived experience leading the way. Now, as you all remember, I am sure, COVID changed everything in 2020. And that was true for PHE because they were delivering their services in schools. So when all of our schools closed, they no longer had access to young people and no way to get their programming and their information out to them. And so because of that, rather than just sitting back and making some choices on the basis of what the organization's leadership thought was the right thing to do, they walked the walk and asked young people themselves to tell them what the most effective way was to keep engaging them and delivering programming. And they displayed then a willingness to invest, because what young people told them, which scared the bejesus out of some of the leadership, was that, hey, if you want to keep delivering this programming, you got to move it online, make an app, do stuff on TikTok. That's where you're going to find us. And so they made the choice to invest time and, importantly, money in making that shift. And brought young people into formal roles to help them set up, create, disseminate, and shape the flavor of the new programming that they were creating. And of course, the organization had some boundaries that it had to respect because of their funders and other rules, but they made that clear with the young people that they engaged in it, what was inbounds and what was out, and worked together to create something new. And the happy ending to the story is that PHE is actually serving more young people than it ever has today, and it's continuing to get the kind of good results that they always have. So, okay, just to dig in on this last piece, because I think that those of you who are investing the time to listen to this are probably really curious about that last of the 5 best practices, power sharing. How do we create institutionalized infrastructure that can be permanent and durable to make sure that young people and other folks with lived experience are actually having an ongoing influence on what decisions are being made and how. So just to dig in a little deep, I'm going to give you some bullet points, and then I want to hear from you all where you've seen examples of this and or where you think that there's room to do more of it. But thing number one is to make sure that from day one, people with lived experience, especially young people, are being brought in to think about what is it that we're even doing here. And so in organizations like I've worked at in the past, these are some of the questions that I wish we'd asked a little bit earlier and had young people give us feedback on. Like, what do you need? Not just what am I prepared to provide? Where and when should we be working with you? And how are we making sure that young people themselves and a representative array of those young people are actually having control over some of those decisions, even if it ends up living with the executive director in the end? How are we giving young people some meaningful control? And it can't just be at the beginning, it's got to be all the way through that we're doing this power sharing work. So this includes, like we just heard about from PHE, how programming is delivered, whether it's framed in a way that is accessible to their priorities in language that they understand. And in giving us all of that information about what's going to work and what isn't, how are we making sure that we're fairly compensating young people for those roles that we're inviting them into? So I think most of this isn't going to be news to those of you who are on this call, but what I'm really curious to hear about, and if you can pull that Menti back up and maybe refresh the screen if you have to, I'd love to hear from your perspective where you would like to see more of that authentic power sharing that I just described. And I'll invite you to do the thing that I've been trying to lean into in my work and my life, which isn't to just say, oh, you know, I think this organization or that organization is doing pretty good. Maybe they could do more of it. Lean all the way into what's possible, not just what's plausible, and feel free to dream out loud here. These are anonymous responses, so it won't come back to haunt you, but I would really love to hear where you'd like to see more power sharing, more authentic power sharing out in the world. And while we're waiting for these to populate, anything new in the chat that I should be responding to?
Nothing new for now. I know for me, when I'm refreshing the Menti, I'm still seeing the old question, but I might restart and try it again and see if that works with re-entering the code.
Ah, okay. Are other people, you can say yes or no in the chat, having that same problem? Not
Looks
getting-
like other folks are having the same issue,
Okay.
that they're not getting the new question. If they want, we can put them in the chat if you're willing to attach your name to it. If not, I totally understand that as well. But while we work to try and see if this works on the main page.
Yeah, I rather than trying to fiddle with Menti, because I'm sure that I'll get it wrong if I try, I'll just invite you all, those of you who are comfortable, to please pipe up in the chat. I'd love to hear it. But I'm just going to move on to the next section, which is going to be our last piece before we wrap up and I take some questions. So one last look at this question before I move on. Now I want to talk about the last piece here, which Mark really previewed for us a little bit at the beginning. And how do I make, there we go, which is talking about intersectional professionals. So this is really the heart of my work these days at the center. Our aim, of course, is to build intellectual infrastructure which takes these two forms. So thinking really big about policies and programs and how they're designed in a way that, as I've been saying, focuses on the possible, not the plausible, where what we're doing combines insights from both what the research says works, as well as what the community says that they need. And what we've realized is that the only way that we're going to get to a future where we're doing this kind of work is if we attend to the people that should be leading that work. And for us, that means talking about intersectional professionals and really cultivating this network, this community that we've built for them. So intersectional professionals I'm going to explain exactly who we are. So these are some examples of intersectional professionals. I'm going to run through a few examples, but you should know that this looks all kinds of different ways. I'm just giving you 3 examples, but there's literally an infinite number of them. But the idea is that intersectional professionals are people who have a dual expertise because they have lived experience of a system that they are maybe doing work, research, or advocacy on, and or that they have professional and academic training on. So here's a few examples. This is a lightly fictionalized version of me, a foster care alum who has a policy degree that goes and does policy work related to child welfare. So that person hits all 3 of these buckets. You could imagine someone else who has lived experience of a system that does work or advocacy in it, but that doesn't necessarily have training, which might be somebody who's a former SNAP recipient that does food justice advocacy. And maybe their degree is in like accounting or something, but they show up and they go to the State House steps and they talk about the needs of people that are using programs like this, bringing their lived experience to bear in an advocacy situation. And then you might imagine on the other side of the Venn diagram, somebody with lived experience and relevant academic training who's not necessarily doing work right on the nose related to their lived experience, which could be somebody who's a survivor of intimate partner violence that does trauma-informed psychotherapy. So they're definitely leveraging that lived experience in their work and their training, but they're not necessarily serving exactly the same community that they came out of. So those are just 3 examples. There's many different ways that intersectional professionals look, but we bring this dual expertise of having that firsthand visceral knowledge of what it's like to navigate a system or an issue, as well as the acumen, training, and expertise that it takes to work on that issue from the inside. So super quickly, why, my goodness. I think my PowerPoint has died. My apologies. So I'm just going to unshare my screen and talk you all through without the slides, the remainder of this. But in essence, what we're building with the Network of Intersectional Professionals is a community that attends to our well-being. Because what we've heard from people as we've gone out to do this organizing is that they, like me, are people that are interested in changing the world, improving it, making it a better place. But in order to do that, they feel like they need their needs taken care of first. So for those of us who've gone back and worked on these systems that we were a part of personally, kind of stuff that we've heard very frequently is that people go back into these systems and they feel all kinds of stuff that is negative. And that might include feeling marginalized. So people being judgmental about the fact that they were once clients of the system or beneficiaries of the system, feeling stigmatized, like they feel unsafe to maybe self-disclose the fact that they've had experience. Or more frequently, for those of us that have been through things like child welfare, we might feel tokenized, like we're the resident mascot foster kid that gets trotted out. And that's the entirety of our value to the system, independent of what kind of experience or training that we've gotten. And so really what the network is about is creating a community of other people that aren't necessarily just from child welfare. These are also people that grew up in public housing that now work at an LHA, people that have struggled with mental health issues that are now working in therapy or allied fields. You get the picture. But that's really our aim, is to make sure that we've got a community that is psychologically safe and committed to making sure that our voices are heard, but also our personal and professional well-being are cared for. So that's really been the majority of the work that we've done with the center is building that network. And there's a variety of ways that we go about doing that, including having some online monthly community meetings and spaces for people to communicate with each other, as well as making room for people throughout the network to do different kinds of advocacy. So you can go online and see our Substack, where we do some thought leadership work and members can talk about their experiences. You can also watch the recording of our annual convening that happened there. But this is really the next phase of my career. As we talked about the 4 phases of it, I am still firmly in the how do we make something superior to what exists. And for my money, my gamble is on making sure that intersectional professionals are cared for, nurtured, and that our voices are uplifted. So why don't I leave it there, because I think we're like coming up on time, and take any questions that are outstanding.
Perfect, Anthony. Thank you. First comment we've got to your previous question regarding where we would like to see more lived experiences incorporated. We have in the chat foster parent and experienced worker trainings. They think it would be amazing to see a youth-led training for realistic expectations of foster homes and hear from youth from what they need from that environment.
Absolutely. And, you know, this is one of the experiences that I had as a young person in my teens and my early 20s, was working with both the state as well as some private agencies to talk about that experience that I had had. You know, what is it like for a teenager to wake up in the middle of the night and not know where they are, you know, to forget that I moved yesterday. Because if you've never had that experience, it's really hard to understand some of the behavior that you might see from young people as they get adjusted to a life in your home. Independent of whether they want to be comfortable there, whether they like you or not, it can be stressful. And the only way that you know, random adults interested in fostering would know that is if they actually talk to people who've been through it. So totally agreed. Love that idea.
Absolutely. First question we've got here is from one of our youth reps who couldn't make it today, but helped us plan this series. And as we were brainstorming its theme, this question is kind of how we came up with it. So super broad, but what is something that you may know now that you wish you would have known when you started your advocacy journey? If you, the whole theme of, if you could tell a younger self something, what would be that piece of advice that you wish, you would have known that now looking back, you learned later?
It's a great question. So one of the things that we do with the network is to give trainings to our members that we call Strategic Sharing 2.0. And I know strategic sharing is a big theme that you all are working through. We call it Strategic Sharing 2.0 because it's not a repetition of the original curriculum that was designed by FCAA and Casey Family Programs back in the early 2000s. It's updated with some new insights and tools and techniques that we're drawing from organizers and social psychologists. But the thing that's at the heart of it, which I think other organizations have said in the normal strategic sharing trainings, is that you deserve to have control over your story. And what we try to impress on people, and what I want any young person that's listening to this to remember, is that that includes saying no. No one is entitled to hearing the gory details if you're not willing to share them, if you're not ready to share them. No one's even entitled to hear the nice stuff if that's not where you're at. So I really want to convey to anyone that's listening to this, young or old, that I wish I had known earlier that I deserved autonomy over how much of my story I shared, where, when, and why.
That's great. You control your own story. We will make sure to note that and repeat that. On a similar note, you mentioned tokenism earlier in your talk. Sometimes tokenism may feel like it's unavoidable. What is your advice to someone who may be feeling discouraged because their voice, their story, their advocacy efforts, weren't valued or incorporated the way they might have expected it to be? And if you want to give an example, you can, but mainly just how do you bounce back from that to not be discouraged?
It's a fantastic question. So I'm going to say a couple things. I'm going to lead with what I think is the pragmatic response. In our network, we often have talked about tokenism and wrestled with the fact that many of us feel like sometimes it's a necessary compromise that we have to make to achieve an outcome that's meaningful to us. And in those circumstances, we engage in what we call consensual tokenism. So, okay, fine. You need the mascot foster youth. You need the Black or brown person. You need someone who's visibly queer to show up and do the thing. Fine, as long as it's for a good reason that I endorse, that feels worth the sacrifice that I'm making. So if I'm paying in terms of losing some of my privacy, losing some of my dignity, or even just not saying explicitly all the things that I think are at the top of my agenda, in order for you to get this funding, in order for the organization to get a higher profile, and that trade-off feels right to me, sometimes I'll just do it. So, and you shouldn't feel bad or guilty about making active choices like that, as long as they're active choices that align with your goals and your values. So that's the easy part. Sometimes we engage in consensual tokenism, and that can be okay if the calculation is right. The other piece that I'll say, though, is that at times, people that you know, love, and respect don't even recognize that they're tokenizing you. So there's some folks out there that are very callous and ruthless, and I would say avoid those people because they will exploit your story in whatever way they want, whenever they want to. But there are people out there that care very much about your well-being and respecting your autonomy and dignity that may not recognize that they're tokenizing you. And so my strong advice there is to if that happens, give yourself a moment to breathe and process it, because you don't want to react hot, and then come back to people and have an explicit conversation where you say, hey, here's what didn't feel right to me about that interaction where you disclosed on my behalf something about my story. Next time, can we do X? And come with some concrete, constructive perspectives about what went wrong and how it might go differently in the future. And I know for sure that this isn't always plausible given power dynamics. But the more that you practice it, the easier it'll get.
Sure. So do things stand out? Pragmatic trade-offs, but then also, taking care of yourself, and knowing that you do still control the story. And we know we talk about intent versus impact all the time, and even those with good intent might not see their impact. So
That's
using
right.
your voice to remind those that exists.
That's right. And they won't learn unless you tell them, So if these are people that you value as colleagues, collaborators, mentors, you got to figure out ways to pipe up.
Sure. Question from me. I feel like we, and when I say we, I don't know, maybe the state of Indiana or state systems within Indiana that are working on and improving just this whole idea of lived experience. We are at a point where we know and agree, there's agreement on lived experience matters. Even if there are folks who are maybe more hesitant to engage with it, they know at least that it matters, and they know to say that it matters that nonetheless. So, however, we also know that by no means perfect in how we engage with this topic as a whole. My question to you, for me, is how do I leverage my position, whether that's coordinator of the Children's Commission, our professionals on this call, young people who sit on an advisory board, wherever that may be, how do I leverage my position to improve our practice with lived experience as a whole?
Mm-hmm. Yeah. Fantastic question. And I think that it comes back to that power sharing slide that we looked at earlier, and making sure that, it sounds like you've got the mindset already. And so the question becomes, how do I create feedback loops and mechanisms that don't require me to be sitting in the seat for this program, this chunk of the agency, to take seriously feedback from affected communities? How do I leave behind an infrastructure that automates this? And that could look any number of ways, including things like, can you write in a procedure manual that when you assemble your advisory board, it needs to be constructed in a certain way that ensures different kinds of voices are at the table? Can you work with HR to create job requirements for listing professional opportunities that give people a score for having lived experience that matters alongside things like degrees and certifications? Can you make sure to listen to and build into your infrastructure the kind of things that will allow people to succeed in this environment? Like maybe folks need a hotspot so that they can log on to the virtual conferences because their Wi-Fi won't support it. So that's the kind of stuff that you can leave behind infrastructure-wise to make sure that it's not Blaine, but it's the system that's doing the right thing.
No, I appreciate that, and knowing that those things can be small or huge, we can leave behind policies and procedures that ensure that those things are being considered, but then also the more and more people that are doing that within a system, then it becomes the norm. So I think that's helpful. So if there's we're almost out of time, but if there's any last quick questions in the chat, please put them there. Ali or Mark, if you both who are on screen have a question, now is a good time to get one in. I'll leave the floor blank for just a minute to see if anything pops up, or if anybody from our commission team has any last minute questions they have. If not, Anthony, I know I can speak on behalf of our team, and hopefully those folks who attended, that we really appreciate you taking some time out of your evening to share not only your story, but your advice and your experience, your expertise, your research, your work, and the list goes on. We can't say thanks enough. Like I mentioned before, this is recorded. I will get it out to folks when we have a way to distribute that. We appreciate our attendees for taking time out of their evening. to be with us tonight and hopefully learn something and took away something they'll take back to whatever setting they operate within. I just want to remind folks on the call that on November 6th at 5:30, we will have part 2 of this. You can access it via the same link you did to get onto this one. And we will do a little bit of a more interactive training around strategic sharing. And then 2 weeks after that, we will have a young adult peer discussion panel to share some, advice on advocacy journeys themselves. So again, thank you, Anthony, so much for your time. Thank you, attendees, for hanging out with us. And please reach out to me. Attendees, you have my email. If you have any questions or any follow-ups, I'm sure Anthony would love to answer. If you think of questions afterward, I'm happy to filter those his way. So please don't hesitate to reach out. Thanks, Anthony.
Thanks for having me, y'all. Take care, everyone.
Thanks, everybody. Take care.